Are you okay? Jim, come here, quick. Call 911. Your mother has no breathing and no pulse. I'm going to start CPR. 1, 2.
Brain cells can live only 4 to 6 minutes without oxygen if breathing or heartbeat stop. The bystander is the vital link to keep the brain alive until professional help arrives. Cardiopulmonary resuscitation, or CPR, may be needed in heart attack, drowning, smoke inhalation, suffocation, drug overdose, electric shock, and other accidents. Knowing the ABCs of CPR can save a life. A. Open the airway. B. Restore breathing. C. Restore circulation. Each ABC step begins with assessment. Never attempt resuscitation unless you first determine that a person is unresponsive. Shake gently and shout, "Are you okay?" If there is no response, call for help and position the person properly. Open the airway, then assess breathing. Look, listen, and feel for breathing. If there is no breathing, pinch the nose and give 2 breaths. Next, assess circulation. Check the pulse for 5 to 10 seconds. If there is no pulse, activate the emergency medical system and begin chest compressions. Everyone should learn how to gain access to the local EMS. In most areas, the number to call is 911. Be ready to give the address, including cross streets, what happened, and any action taken. Always hang up last. Here are the ABCs in detail. Immediate opening of the airway is the first priority in a successful rescue. During normal breathing, the air passages are open. When someone becomes unconscious, the tongue often falls back against the throat and blocks the airway. Use the head tilt chin lift method to open the airway. To do this, put one hand on the forehead to tilt the head back, while placing the fingers on the bony part of the jaw to lift the chin. This lifts the tongue from the back of the throat and opens the airway. Keep the fingers on the bony part of the jaw near the chin, not on the fleshy part underneath, which might obstruct the airway. If an unconscious person is breathing, maintain an open airway until help arrives. If breathing does not resume after opening the airway, restore breathing. Give 2 breaths. Inflate for 1 to 1.5 seconds on each breath. Then check the carotid pulse. Place the fingers on the Adam's apple and slide them into the groove on the side. If a pulse is present, but there still is no breathing, continue rescue breathing. Keep the head tilted back. Pinch the nose to keep air from escaping. Take a deep breath. Make a tight seal around the mouth and blow until you see the chest rise. Watch the chest fall as the victim exhales. You should hear and feel the exhaled air. Repeat every 5 seconds or 12 times a minute. Mouth-to-nose breathing may be used if the mouth cannot be opened or if there is damage to the mouth. Lift the chin to close the mouth and blow through the nose. It may be necessary to open the mouth to allow the victim to exhale. Sometimes opening the airway and breathing for the person are not enough. If the pulse is absent, restore circulation with external chest compression. The heart lies in the middle of the chest beneath the breastbone or sternum. Compression should be over the lower half of the sternum, but not over the xiphoid, which is the lower tip of the sternum, since pressure here may cause internal injury. For hand position, find the notch where the ribs meet the sternum. Run 2 fingers along the margin of the rib cage until the middle finger reaches the notch. Place the heel of one hand next to the index finger. Then place the other hand on top. Compress the sternum straight downward with enough pressure to move it 1.5 to 2 inches on an adult. The fingers may be interlocked to keep them off the chest. Compression of the heart between the sternum and the spine and pressure inside the chest forces blood out. Relaxation of pressure allows the heart to refill. Use the heel of the hand only. Position the victim on a firm surface. Properly performed CPR produces only 25 to 30% of the normal blood flow to the brain. Doing compressions correctly, as shown here, is of critical importance. With your shoulders directly over the chest, press straight down at the rate of 80 to 100 times per minute. Compressions should be regular and smooth. Half compression, half relaxation. A common error is the rocking chair technique, where compressions are done from the side instead of straight down. The arms should be straight with the elbows locked. Bending the elbows soon tires the arm muscles. The natural weight of your body should be doing the work. Keep the heel of the hand on the sternum at all times. Compress and release in a steady rhythm. Bouncing compressions are less effective and are more likely to cause internal injury. Keep your fingers off the chest. Use the heel of the hand only. Massaging or pressing on the chest with the fingers may cause rib injury. Another hand error is the crossed hand technique, which makes it difficult to keep the correct position and pressure on the sternum. Avoid these common mistakes when performing chest compressions. Don't be a rocker, a bender, a bouncer, a massager, or a double crosser. Assess the need for CPR. First, check for unresponsiveness.
Are you okay? Somebody help. Call the paramedics. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
When there is one rescuer, compress the chest 15 times, then give 2 breaths and quickly resume compressions. To maintain a rate of 80 to 100 per minute, count.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13.
Lean over to give the breaths without moving your knee position. After the fourth cycle and every few minutes thereafter, check for return of spontaneous breathing and pulse. If there is no pulse, give 2 breaths and continue CPR.
One and 2 and 3 and 4.
A second person who knows CPR can offer to help.
And 9 and 10
I know
and 11
CPR.
and
Can I
12
help?
and 13 and 14 and 15. Yes.
At the end of a cycle after the ventilations, the second person checks the pulse. When practicing on the same mannequin, the second person simulates the breaths and begins chest compressions. The effectiveness of CPR can be assessed by the first rescuer by checking the pulse during compressions.
9, 10, 11, 12, 13, 14.
Determine if the child is unresponsive. If there is no response, call for help. Open the airway, look, listen, and feel for breathing. If there is no breathing, give 2 breaths. Check the neck pulse, feel gently. Maintain head tilt with the other hand. If there is no pulse, activate the EMS and begin chest compressions.
2 and 3 and 4 and 5. 1 and 2 and
After each 5 compressions, pause to give 1 breath. Count.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
Use the heel of one hand only to press the sternum down 1 to 1 1/2 inches. Continue for 10 cycles, then recheck the pulse. If there is still no pulse, give a breath and continue compressions.
1 and 2 and 3 and
If the infant is unresponsive, call for help. Open the airway. Do not overextend the head. If there is no breathing, give 2 breaths. Make a tight seal over both mouth and nose. Check the arm pulse. Feel gently with the fingers. If there is no pulse, call the EMS and begin chest compressions. Correct finger placement is 1 finger width below an imaginary line between the nipples. Use 2 fingers to compress the chest 1/2 to 1 inch. Do not press over the xiphoid. Compress 5 times, then give a breath large enough to make the chest rise.
1 and 2 and 3 and 4 and 5.
The compression rate is at least 100 per minute.
1 and 2 and 3 and 4 and 5.
If someone is eating and suddenly chokes, a normal reflex is to grasp the throat. This universal signal indicates, "Help, I'm choking."
Are you all right? Are you choking? I can help.
Death will occur within 4 to 6 minutes unless the object is dislodged.
Are you okay?
Often, a foreign object can be dislodged by using the Heimlich maneuver on the area below the rib cage, just above the navel. From behind, place the thumb side of the fist against the abdomen, grasp the fist, then give a quick upward thrust. The Heimlich maneuver creates an artificial cough as the diaphragm moves upwards to force air out of the lungs and to dislodge the object. If you are alone and choke, you can do abdominal thrusts with your own fist, or by leaning over a firm object such as a chair. If the choking person is unconscious, straddle the thighs and apply the Heimlich maneuver with the heel of one hand and the other hand on top. Small rescuers can use the weight of their own bodies for the abdominal thrusts. To avoid injury, always practice on mannequins. Someone who is choking cannot speak or cough or breathe. Each thrust should be a separate maneuver and given with the intent to relieve the obstruction. It may be necessary to repeat 6 to 10 times. If the person becomes unconscious, call for help. Turn face up and open the mouth to perform a finger sweep. If unsuccessful, open the airway and attempt mouth-to-mouth breathing. If unable to ventilate, kneel astride the person's thighs and administer abdominal thrusts. Press inward and upward on the midline, not to either side. Repeat the sequence if necessary. Sometimes choking is mistaken for a heart attack. It is important to assess the difference, as the resuscitation procedures are not the same. If someone appears to be unconscious and you do not know why, begin assessment. If there is no response, call for help. Position on the back and open the airway. Check for breathing. If there is no breathing and you cannot inflate the lungs, reposition the head and try again. If unsuccessful, call the EMS. Perform abdominal thrusts. If the airway remains blocked after 6 to 10 thrusts, open the mouth to perform a finger sweep. Attempt to ventilate. If unsuccessful, continue abdominal thrusts, finger sweep, and attempt to ventilate. Repeat the sequence if necessary until the object is dislodged or help arrives. The technique for children is similar to adults. Determine if the child can speak or cough. Kneel behind the child and wrap your arms around the waist. Press into the abdomen with quick upward thrusts. It may be necessary to repeat 6 to 10 times. If the child is found unconscious, call for help and position on the back. Open the airway, check for breathing. If there is no breathing, try mouth to mouth. If unable to ventilate, reposition the head and try again. Activate the EMS. Perform 6 to 10 abdominal thrusts if necessary, then check the mouth by lifting the lower jaw. Remove object only if seen. Avoid blind finger sweeps on a child. Kneel at the feet or knees of a smaller child and apply gentler thrusts. The Heimlich maneuver used for adults and children is not recommended for infants under 1 year. Instead, a combination of back blows and chest thrusts is used. The head is firmly supported, holding the jaw. The infant is straddled face down over the rescuer's arm. Give 4 back blows between the shoulder blades. Sandwich the infant and turn it over to give 4 chest thrusts 1 finger width below the nipple line. Give the back blows with the heel of the hand high on the back. Turn the infant over as a unit, supporting the head. Do not press over the xiphoid. Repeat if necessary. With a larger infant, you can sit or kneel using the thighs for support. If the infant is found unconscious, call for help and open the airway. Check for breathing. If there is no breathing, try to give a breath. If you cannot ventilate, reposition the head and try again. If unsuccessful, call the EMS. Give 4 back blows, followed by 4 chest thrusts. Open the mouth to check for a foreign object. Remove only if seen. Attempt to ventilate. If the airway is still blocked, continue back blows, chest thrusts, mouth check, and attempt to ventilate. Repeat the sequence if necessary. In the United States, about 3,000 people die from choking each year. However, in adults, choking occurs much less frequently than heart attack. Heart attack is the greatest killer of modern times. 540,000 die each year from heart attack. Over half of these victims die before they reach the hospital. Needless deaths can be avoided by attention to known risk factors. Some risk factors, such as age, sex, race, and heredity, cannot be modified. But other risk factors can be modified by prudent living. Avoid smoking. Have your blood pressure checked. Eat less fat. Avoid too much stress. Exercise. Lose weight if necessary. Also, learn the signals and actions for survival if a heart attack occurs. The signals are pressure or squeezing pain in the center of the chest lasting 2 minutes or longer. The pain may spread to the shoulders, neck, or arms. There may be weakness, sweating, fainting. Denying these symptoms can result in sudden death. If these signals occur, take action. Call the EMS, or if you can get there faster, go to a hospital with a 24-hour emergency cardiac care facility.
Did you remember to pack that extra sweater, dear?
Yeah, I got it.
Likely pretty chilly this time of year.
Did you see my waiters?
Are you okay?
I'm fine. It's just humid today.
I'll look in the house.
Kevin, for crying out loud, go help your mother.
What's wrong, hon?
I don't know.
Honey? Richard? Oh no! Richard, are you okay? Kids, help! Somebody help! Arlene, call 911. I think your daddy's had a heart attack. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
You go wait for them.
8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
No pulse. Okay.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8.
Okay, hold
9.
CPR. He's in VFib. Okay, clear?
Clear.
He's still in fib. Check for pulse.
No pulse.
Okay, clear?
Clear.
Still in fib. Check for a pulse.
I got a pulse. Looks like he's trying to breathe on his own.
Okay, I'm seeing a sinus rhythm.
Hand me some electrodes, Jeff.
Okay, 110 over 60.
Robin Hospital, this is Culver City Rescue 3. We have a medical emergency. We're at a home here. We have a gentleman, his age is about 35 to 40. His weight is approximately 180 to 200 pounds. On our arrival, we found the patient down in full cardiac arrest with bystander CPR being performed.
Stand by, please. Jeff, they want 100 milligrams of lidocaine slow IV push.
100 milligrams lidocaine.
I'll get the gurney.
Is Daddy gonna be alright?
He's gonna be just fine.
A sudden death has been prevented by prompt bystander CPR and early entry into the emergency medical system.